everyone, and welcome back again. We're here again, another week, another day, another dollar, another week, another podcast.
Fantastic to see you again, Jack. We are meeting again in person.
We are. It's very exciting.
What's our topic today, Jackie?
Oh, our topic today is we're all about building rapport with our clients. So we've got some questions to tell you.
I'm just really happy that this isn't controversial.
Hopefully not.
No, it's just something we should be doing.
Yes, it is definitely. We absolutely must be chatting with our clients, asking them all sorts of questions, finding out about their health, all sorts of things. Yeah.
Do you know what the really good outcome of doing these things is, Jackie?
Am I supposed to know the answer for that?
Oh, it's not just about generating paperwork for us to do.
What?
Because who needs more paperwork in their life?
Oh.
But asking questions of our clients builds relationship, and it builds trust and connection.
Absolutely. Love it. It does. It's so good.
There's studies around which show quite clearly that therapists, not therapists, but clients, or I guess these have come out of the world of surgery. So patients who trust their surgeon, and let's face it, a lot of surgeons have got really bad person skills. So patients who have a relationship with and trust their surgeon have better outcomes than those who don't.
Yes, I have read some of those articles, and it's very interesting. Yeah, absolutely.
So this is us establishing some things up front, and the brain does the rest of the work for us. It's fantastic.
Yay!
We look competent, the client wins, everyone's happy.
Oh my gosh. David, here's a question, and I already know the answer to this. Have you ever been for a massage in a shopping centre?
I have.
You have?
Yeah.
I know you have, because you tell me, and I'm constantly saying, why are you doing that?
Sometimes it's because I can't get him to see who I want to see, and I just need something there and then.
I haven't been for a long, long time, and I went for the first time this year. I'm pretty sure it was this year, and they didn't even ask me my name. They didn't ask me anything about myself. They just asked what did I want, which was basically I just want a back massage for 30 minutes. And yeah, basically it was, I walked in, laid down on the table, they came in, did the massage, and then I finally knew that it was over because they left the room.
Sometimes that's just what people want.
That's true. Yeah. That is true.
Now, this is where we get a bit of an expectation gap when a client will come in for the first time and they're shocked that they've had to fill out an intake form.
Yeah, I've had a few of those over the years, and they're like, what do you need all this information for? Firstly, some of it is legal.
Mm-hmm. Second, I don't want to hurt you.
Yes, absolutely.
Because what's worse that could happen during a massage?
The absolute worst thing, very worst thing is that somebody might actually die.
Yeah. That's a really bad day at the office when that happens.
Super bad. I have to say though, we have to add the caveat that massage is quite safe. Usually most of the time, if we ask the question.
Correct.
And that is reflected in our low insurance rates.
Yeah, it is.
Compared to other things like chiropractic and all the medical stuff.
Yeah, super expensive for those people. I did have a client come in once. Well, actually, I can't really call them a client because I didn't do any work with them. They came in and this person said, "Look, I've just landed. I've got really sore calves. Can you help me?
I've been on a plane and my calves hurt."
Yeah, so I asked some questions. And then I thought, I am suspicious, but I'll let the person undress and then I can look at the calves. I can touch the calves.
Yeah, fair.
Yeah, I came back into the room and I touched the person's calves and they were burning hot.
Oh, no.
I said, "I'm sorry, I cannot massage you today." Yeah. And we're not allowed to give a diagnosis.
Oh, so annoying.
But this person's like, my legs hurt. You need to help me. I'll just go somewhere else. Like, I'm sorry, I cannot massage you today. You need to go to the hospital, but I suspect you've got a DVT.
Yeah.
If I don't know what the outcome was. I tried to call. I never heard anything back. I might have been completely wrong, and I just caused that person hours of inconvenience. May have just saved their life, but if I had worked on that person and they died, I would be negligent.
Absolutely. I've actually had that very similar scenario with one of my ladies. I do some aged care massage, and one of my elderly ladies who I adored, she was very lovely, went to see her one day, and similar situation. Her calves were so red and warm, and I was just like, I just can't touch you. I'm like, she was probably 80 as well. I'm like, I just could not do it. And so she ended up calling the ambulance after I'd left. Got the ambulance over, went to the hospital, got checked out. I think she'd called her GP first. And it turns out she did not have any DVT. There was no issue. But if something had gone wrong, I would never, ever, ever have forgiven myself. Never. Oh.
You can imagine the conversation with the family.
Yeah, exactly.
As you're calling the next of kin on that person's intake form.
Yeah.
To say, I'm sorry, but your loved one has gone their way to hospital.
Yeah, no, absolutely. And it's such a huge thing. This is slightly off topic, but it's such a huge thing now with aged care that we as therapists, whether it's massage therapists or carers or something else, but in aged care, there is so much that we have to do in regards to actually making sure that we put our clients' needs first. If they have had a fall, there's a process we have to follow. If they are feeling unwell, there's a process we have to follow. And that's a good thing, honestly. Yeah, okay, back to the topic at hand. The questions that we as therapists are asking are setting the expectations and the boundaries for our business, for our clients, for ourselves. And we do have an episode that we've previously released about negative feedback, receiving negative feedback, good feedback. So yeah, definitely have a listen of that one. That's a good episode.
Because the expectation gap is, I think, the biggest complaint thing about is pressure. Not enough pressure. Now, therapeutically, pressure is it's subjective, and whether lots of pressure is actually needed or if it's just wanted. But the other thing is that the therapist just hasn't worked in the area of concern that the client wanted, and this is why questions are important.
If you take away one thing from today's episode, we would like it to be that if you absolutely do not do anything else, take a really good history of your client, please.
Yes. And a lot of our clients don't understand because they may have had that experience of going to the shopping centre. Maybe they've had a massage at the beach while on holiday, and that's just how things are done. Nothing is asked, not even your name. And they don't understand the importance of asking questions because massage is simply a relaxation thing which is completely safe, which as experienced therapists we know that's not the case, and you need to manage that expectation. And this is where it's really important to have a thorough intake form, and your association has templates for that if you don't have one, that they fill out online or on paper on arrival.
Yes.
And we've got those people who just write their first name, maybe, and that's it. And you have to fill in the blanks.
Again, this is slightly off topic, but there are some legal requirements to that intake form. We will go over that in another episode, but there are a certain amount of information that you must take from your client to be legally compliant with your association and also the health funds. We're not trying to give you more paperwork because we don't want the paperwork either. But it has to be done.
And these are wrapped up in legislation again as part of the Unregistered Health Professionals Act.
Mm-hmm. Absolutely.
So not unregistered? Yeah, Unregistered Health Professionals Act. Not unregulated, we are heavily regulated. Even if you think we're not, we are regulated, but we are unregistered health professionals.
That's the one.
Yep. All right. Well, when the person arrives, this is your time to assess their personality, because someone who's a bit type A, they might want to see you demonstrate your knowledge to them. This is part of them forming trust, and they want to see you do all of the tests. Even though they've come in with a sore finger, they'll want you to test their toes.
Especially if that's what they're used to. Yeah.
And expect them to ask lots of questions, and they will expect you to know exactly what muscle is being affected.
I don't like those people.
Yeah. Whereas other clients are a bit more go with the flow, and if you do too much testing, they'll find this annoying. And so if you don't meet people's expectations up front, then they may judge you for that, which that may sound a bit harsh, but it can be a good thing to weed out the people who are just not a good fit for you and your treatment style.
Absolutely. So what do you want to start with? You want to start with, hello, my name is Jackie. Okay, super obvious. But it is really important to address the person that you're seeing by their name. So, and now that might be fairly simple in the case of if I've written down my name is Jackie, then you go, okay, your name's Jackie, I can pronounce that.
But maybe it's Jackie.
Maybe it's Jacqueline.
Could be.
So yeah, so it's not always super obvious, but really helping to connect with your client is actually using their name. That's probably one of the most basic things and also one of the most annoying things, because some people, me, are terrible at remembering people's names. So I have to work extra hard to remember people's names a lot of the time. And I know there's a meme or something, David, where it's somebody walking over into the other room to greet their client and then walking back because they've forgotten their client's name. So they've gone to check it up on the system again.
Do that frequently. Even when they're standing in front of me to rebook. I've just spent an hour with this person. I can't remember their name.
You have to check today's appointment before you can remake next week's appointment. Yes. Hello, everybody.
I can remember all sorts of things about you, but not your name. So if I'm not familiar with the person's name, I might ask them how to pronounce it. We are quite a multicultural society where not everyone has Anglo names. Or I might ask them what name do they prefer to be called, because not everyone goes by their birth name. They might go by an abbreviation. They might go by a nickname as what they prefer to be called. But after the name, the next question I'd ask is, why are you here today? If there's something specific that I can help you with.
I don't know why, David, but I'm reading this list in a very snarky voice. Why are you here today? What are you here for?
Why did you bother coming to see me?
What can I help you with?
I suggest that you are not snarky to your client.
No, absolutely not. It's just my funny brain being weird.
I have actually had that as an experience, though. Why are you here today? It's like, okay, so my money's not important to you today.
Oh, no.
Some people have just got really bad customer service. And they shouldn't be in positions of care.
Oh, no. That's usually more of a retail thing, not a healthcare thing, but...
Or the nurse who's been around for 30 years. They just hate people.
What's wrong with you? Oh, dear. No, absolutely. A variation of why you're here today could be, how could I help you? Do you have a specific issue that you're looking for massage? And if you work with very specific subset of health conditions, whether that's lymphatic drainage or headaches or ankle injuries, knees, I don't know. You can be very specific with your questioning, what's happening with your knee? And then that's leading into, okay, has this happened before? How did it happen? Tell me all about this injury. What have you done?
How did it happen? How is it affecting you? These are really important questions. And look, I've got a hip injury at the moment, which is almost better. It's taken a few months, and One of the questions that was asked of me by the physio who was treating me is, what is this stopping you from doing? Because most of the time it doesn't bother me, except when I try and sit on the floor with my children.
That's an excellent question. I love that one. Yeah.
And because they were saying, if it doesn't bother you most of the time, like, why are you seeking treatment? Because I want to sit on the floor with my children.
Yes. What is it stopping you from doing?
Yeah.
So did we mention before that we have the intake form? You should have read it before your client enters the room.
Yeah.
You can also ask your client, are there other illnesses or injuries that you haven't put on your form that you need to be aware of? So I know with mine's an online form, and sometimes people will be filling it out in front of me, even though I've sent it to them a week ago, and they'll and they'll say, oh, I've got this and I've got this and I've got that, and they might have quite a complex health history, and I'll be like, okay, jot down the main things, and then we'll talk about it, and then I will make some notes as we go. So I'm letting them know that if they do have more than, I just get headaches, it's just dehydration, or it comes with my cycle or something, if they've got those complex needs, that we are going to talk about it and that we are going to make notes about it, and I'm going to pop it all down.
Yeah, and we're only going to put down a few suggested questions that you asked today, because with every part of the body and every condition, there's a whole bunch of questions that you can and should ask. And for something like headaches, it could be along the lines of, do you have a headache today? How severe is your headache today? Is it worse or better than usual? Do you get headaches very often? How often? Have you spoken to your GP about your headaches? Is this new for you? We were just having a bit of a banter before about one of my clients who came in to see me, and he told me he had a headache. And I asked him some questions because this was a new symptom for him. It's like, I get headaches sometimes. Okay, what have you been doing today? I've had a lot of time at my desk today. I've been doing lots of paperwork. I've been staring at my screen. And it was at the conclusion of the massage when he's come out into better lighting and I see a bruise under his eye. I said, it's a nasty bruise under your eye. How did that happen? I got hit in the face during footy. I got knocked out. I went, oh. Do you mean knocked out as you got knocked to the ground? No, I was unconscious on the ground. When did this happen? Oh, it happened 3 days ago. I said, this is something that you probably should have told me at the start of your treatment. Oh, I didn't think that it was relevant. And this is our clients not knowing the importance of these questions or what the potential impacts could be. So I had just worked on someone with a fresh traumatic head injury. And at the end of that session, I took some furious notes.
I actually can't believe that this happened. That the guy just was it the concussion that made him forget that he had the concussion? Is that what happened? How do you not say that to the... my brain just right now.
I've got a headache today. Perhaps it's because I got hit in the head. I fell to the ground and was unconscious 3 days ago. Maybe. And I've had to take 2 days off work.
Oh, gosh. Well, yeah, that is something we absolutely have to remember as massage therapists as well, because I'm pretty sure all of us have a similar story where we get halfway through the treatment and then get told, oh, I've got a pacemaker. Or get 3 appointments in and then get told, oh, I have this genetic condition, or some variation of that.
Yeah, it's a really sensitive area, and you could spend easily an hour with a person taking their history to be very thorough, and they would be super annoyed with us if we spent their entire session just taking history. We've got to be really targeted about what we do ask. And again, when they don't really understand why we're asking, or maybe they don't want to disclose that information to us, maybe there's some trauma wrapped up in their condition and they don't trust us yet to reveal that information.
That is true. Very true. And also, some people do forget things, not on purpose, but they've lived with it their whole lives. They might just not think it's important anymore. They live with it. They cope with it. They manage it. And to them, it's not a big deal. But to us, it might be a big deal. And they've just gone, oh, shit, yeah, I forgot about, my leg or whatever.
Yeah. People do forget injuries. I forget my own injuries. I've had so many of them.
I forget my own name half the time.
I just forget my clients' names.
We do have to be very sensitive to where people are at, though. And I'm not absolutely not trying to make light of this at all, but there are some things that are very traumatic for people. And I personally find this with working with pregnancy as a therapist, that a lot of women and couples, I will say a lot of people do experience things, very traumatic events like miscarriage and stillbirth. And the death of a child as well. And this is such a sensitive topic, and we have to be extremely understanding in some conditions, for some situations rather, that people either do not want to talk about something, and grief is a very, very complex topic.
Yeah.
That we generally are just not informed about very well. We're not educated about how to manage grief and how to deal with other people's grief. But if you're working in a specific niche like pregnancy, this is something that absolutely we should be getting extra training in.
Yeah, and the same for chronic pain. The number of people who present with chronic pain, and as you get to know them and you start to unpack their life stories, you realize that there is often a lot of childhood stuff, not necessarily sexual trauma, but that is very common. But yeah, a lot of childhood trauma, which the neurological effect, the psychosomatic effect, is probably playing quite a large part, either in their pain or certainly in magnifying that experience of pain.
Absolutely. So, and this is where reading body language can be helpful.
Yeah,
sometimes
they start to clam up. It's not the time to go probing.
Absolutely. Yeah.
Really good question. If someone's presenting, it could be an existing client, but they're coming with a new condition, or maybe they are the person seeking help for the first time, and to ask them the question, have you sought help from another professional for this concern? And if they say yes, what was the effect? Did it work? Because probably the reason why they're coming to see you. I've seen this person, it had no effect, so now I'm trying massage.
I've had many, many conversations with my clients who I am a woman, and I see a lot of women clients from varying ages because I do pregnancy, but I also see a lot of older women. So we have this conversation all the time about general health. And I will ask my clients, okay, so you've been to the GP, right? What did the GP say? Well, and then we have a conversation about GPs and going to the doctor.
Yeah. Yes, it's very common.
Very common. Very, very common. I can't remember where I was going with that.
Well, we're preparing for another episode called Things They Never Talk to Us About in Massage School, and I wasn't quite prepared for the amount of women's health information that I've now come to be familiar with. And it's actually really helpful as a male practitioner being able to discuss openly women's health. And then for people to turn around and say, oh, my doctor has never talked to me about this. It's like, yeah, I know.
And this is the conversation that I'm having with all of my women clients. Honestly, it's ridiculous. But I think it's really important for us as an industry, because what's the number going to be? What percentage of clients of us do we have that are women? It's got to be like 75%, maybe.
Easily.
Yeah.
Easily.
And so at some point, your female clients are going to either have a period or go through menopause. And some of that can be really messy and horrible. Yeah.
And the number of female clients who are dismissed by a medical practice are saying this is just a normal part of being a woman, when some of these things totally are not normal. They might be common, but they're not normal.
Absolutely. Yeah.
And that's where having a good referral network is important. You can point them in the right direction. The massage isn't going to correct this, but I can help you to find someone who will. And particularly following childbirth, I work with a lot of female clients as well, and the number of women who will talk about incontinence and they're just told by their medical practitioners that they need to accept it, there is help available.
Oh my God.
Available.
Yes. Please, could everybody go to the pelvic floor physio, women and men, make yourself an appointment and seek assistance, because yes, this is such a topic that is never talked about. We talk about it in dark rooms, in hushed voices, and most women will absolutely never say, I actually pee when I cough, or I feel like I might be incontinent, and what do I do? Like, it is so not spoken about. And yeah, this is just such an important topic, because guess what happens when you hit 80, 85, whatever the age is? You're wearing a nappy, you're incontinent.
Yeah. Another question that you could ask is, have you ever had a professional massage before? What was your experience? What did you like about it? What didn't you like about it? Because they may be shopping around for their massage therapist because their previous experience was not a good one.
That is such a great question. If you are having a new client and chatting with them and finding out what they do and don't like, what they do and don't want through the session, asking them about music or lighting or preferences for room temperature, that sort of thing, could potentially make or break the session. If you know, especially if you know that your client has been elsewhere and come in and said, oh, I went to this other place, around the corner, and it was just terrible. Okay, well, what was the part that you didn't enjoy? Why was it terrible?
Mm-hmm. Yeah, it would be really nice not to make that mistake again.
Yes, especially if it's something really simple, as in the music was just too fast or too loud or
too plinky plonky.
Too much piano.
I didn't like panpipes. Might have been the sound of the coffee grinder next door or something. They didn't like cupping, but you did it on them anyway.
Oh, yes. That's a good one.
Let's go back to episode 7 and talk about consent.
Oh, gosh. It's very important as well to check in with your client, how they are feeling throughout the appointment. So I'm not talking about the beginning, but once they're on the table, you need to check in with temperature, especially during the time of year where it's either not quite hot, not quite cold. You're in the in-between time. It's spring, it's autumn. Do I put the electric blanket on? Do I leave it off? Is my client going to have a hot flush on the table today? Are they going through menopause?
Yeah.
Which is super common if you have ladies over 40 in your list of clients.
Yeah, being a male, I'll never get to experience a hot flush. So I always thought that hot flushes were just something you just kind of experienced psychosomatically, like getting a sensation of being a bit warm. Until I had someone have a hot flush on the table and their skin went bright red, they went burning hot to the touch and broke out in a sweat. And I went, oh my God, are you having a hot flush? Like, I was absolutely astounded. She's like, oh, you can feel that, can you? I said, feel it? I thought you're about to burst into flames.
It can be very full on sometimes. Not everybody has that exact situation, but yeah.
But if you see your client getting a bit wriggly on the table, or maybe they're trying to kick the towels off their legs, it's time to check in with them. Maybe they need a bit of extra support underneath their hips. Maybe they do want an extra towel because they're a bit cold. Maybe they want to be less covered because they're hot. Maybe the face dress needs to go up or down. Just check in with them. It'll help to make their experience to be better.
I find it really good with some of that stuff to definitely not ask a yes or no question. Ask a leading question, so they have to explain it to you. So with the temperature is a good one, because instead of saying, oh, are you okay temperature-wise? And they'll most likely go, yeah. If you say, oh, now look, I've got the fan on and I can put the electric blanket on for you. Are you okay temperature-wise? Are you too hot, too cold? You're leading them into saying, oh, I'm fine, but can you turn the fan off? as an example.
Well, for something like pressure, if you just say, how's the pressure? They'll just respond with, yeah, fine. I've been married for a while. I know that that's not a good answer.
Fine is never a good answer.
And so a better outcome or a better question might be to say, would you like me to use more pressure? Would you like me to use less pressure? Or even at the very start of the session, briefing them to say, different parts of the body like to feel different levels of pressure. You might feel more comfortable with more pressure through your back, but prefer less pressure through your legs. It is important for you to tell me. And if you see them start to squirm on the table, it might be a sign to back things off. Even if they say, no, I can take it.
Yes, reading body language, please, guys, come on. You've got to practice.
How often do you hear those words, I've got a really high pain tolerance?
No, I hate that so much. I hate it. It's terrible. Because different, as you said, David, different parts of the body tolerate pain differently. And this is why, like, when you're getting reflexology done, you can often tolerate a lot of pain on your feet because your feet are constantly pressurized. You're standing on them all day. They're in shoes, they're wrapped up, they're feeling stuff all the time. Whereas if you were to do that to, your neck, oh my gosh, like you just absolutely cannot do that. So I know that's probably a terrible example, feet and neck, but I think you get the idea.
Yeah. But it does show to our clients that we're paying attention and that we do genuinely care about them when we notice things. So if they are a bit squirmy, maybe they're just a fidgety person. But you've just given the opportunity to correct something and empower them to feel better throughout their session.
Absolutely. One thing I will say, though, is please do not constantly question your clients and ask them, are you okay? Is this pressure okay? Are you too hot? Are you too cold? Like a couple of check-ins through the massage. First appointment might be a little bit more. Second and third appointments, you probably should be able to read that body language a little bit and you should sort of know. And you can absolutely ask them at the second appointment, how did you go? Was everything okay? Is there anything I need to change? Was the pressure all right? Was the room temperature okay? And that's a really good way to make sure that they keep coming back.
It's absolutely probably the most important question to ask at the second appointment is, how did you feel after your session? What could we do differently? How did you respond? And check in, because if there is something that needs to be done differently, then we should probably do that.
Communication is key, as always.
Here's another really important question to ask. I guess it's a bit roundabout, and this applies to the people who are coming in. I want an hour full body massage, for example. They've been really in very unspecific, and you can ask them, and you should ask them, which areas of the body would you like me to focus on today? Are there any areas that I should avoid? Maybe they just don't like their feet being touched, and if you just touch their feet, they get really uncomfortable. Maybe there's an area of the body that they associate with trauma. There's a lot of body image things that go on, and particularly around legs, and people not liking their legs being seen, let alone touched.
That's kind of a bit of a weird one, but because I was always taught with the belly that bellies are very sensitive and people don't usually want their bellies touched. And so kind of, okay, here's how to do abdominal massage while you're in massage school, but basically don't do it a little bit. But it's legs. Legs are people are just like, no, I hate my legs, or don't touch my legs, or don't massage my legs. My legs are very sensitive.
Yeah.
Yeah, it's crazy.
But often, a lot of shame around the look of legs.
Yeah, that's been something that has surprised me, I guess, as a therapist. Yeah.
I've seen on intake forms there's lots of information which I would consider to be unnecessary, particularly for massage, when they're asking me, am I a smoker? How many drinks of alcohol do I have in a day? What do I do for physical fitness? How many times do I do this? How many times do I do that? Are you sexually active? And you go, this is a bit confronting. Do you really need this information?
Yeah.
All right, you can have my name, you can have my address and my phone number.
Yeah, sometimes we do go overboard, and I think that is inexperience a little a lot of the time, and also not knowing, if you haven't got a lot of massage personally before you start being a massage therapist, not understanding healthcare.
Yeah.
Yeah.
I think we just scratched the surface on the types of questions that we can ask. I think we need to understand that we will get people who just don't want to volunteer information when we ask. Even if we feel that it's necessary, they may not feel that it's necessary. And reading the room is a bit of an important thing to do. It's a skill and an art.
It is, absolutely. Well, once again, we have gone everywhere throughout today's episode. Thank you, David, for being here and chatting with me and covering all sorts of topics.
Been another good one. I hope you found it beneficial. We might even chuck in a couple of links to a good intake form in the show notes, so look out for that. So if you like the information that we are presenting to you, why not head across to Facebook or to Twitter or to Instagram and leave us a little message there. Perhaps even send us a DM. If you are listening on a podcasting app, don't forget to subscribe to this episode so you will not miss any future episodes. And if you are listening on Apple Podcasts or on Spotify, why not leave us a rating or a review? It'll help us to be found by other massage therapists just like you.
Yes, absolutely. Tell all your massage therapist friends all about us. Thank you for listening.
Thank you.
Bye.